Welcome to Carsey Policy Hour at our new time of 8 o'clock. As folks are trickling in, I will ask you to put your name and organization into the chat. Regular viewers and participants know that this is the rebranding of the UNH Carsey School of Public Policy 3-year Coffee and Conversations discussion series. We started live in Concord, and to finally acknowledge the post-COVID world where each of us can have our own coffee and still share virtual conversation in a way that we can reach more people, we have renamed this as the Carsey Policy Hour. We hope this is a way that slots easily into your morning. We stay on the second Wednesdays from 8 to 9 o'clock. Thank our partners at the New Hampshire Bureau of Education and Training and its Certified Public Manager program. We remain committed to engaging policymakers, public service professionals, and active citizens and organizations in the issues and policies that affect the people and places of New Hampshire. Today's topic may be the most important that we've brought forward recently, at least in today's divisive environment, because it shows how people and organizations that might seem entrenched on opposite sides of an issue can actually find common ground and can work through their own direction and door into legislation and other initiatives that seem to bridge these seemingly divisive and separate points of view. It shows how research can go through the sausage machine that is our culture and our society and institutions to lead to outcomes that can change lives. I've been following the bill that Morissa Henn will be speaking about today as it passed 3 states, including her experiences in Utah, and had secured her as a speaker on this before I knew that Representative David Meuse had introduced the bill this legislative session as HB 1050. So Carsey and the University of New Hampshire are unable to advocate for or to push for any particular legislation, and that holds today too. Our focus remains the process of how to bring together seemingly diverse and divisive groups and ideas. But we've asked Representative Meuse to present the policy because of its similarities with Utah, and also to bridge us to applying Morissa's lessons to New Hampshire today. Again, please put your name and organization in the chat if you are just joining us. The discussion will follow the speakers and will be done through the Q&A and chat. So please feel free over the course of Representative Meuse and Morissa Henn's presentations to put your questions and comments, and I will facilitate after. So without further ado, Morissa Henn, Deputy Commissioner of New Hampshire's Department of Health and Human Services, can introduce herself and her work in the state. We're particularly delighted to welcome her today because of her experience in Utah, collaborating with colleagues at the Harvard Injury Control Research Center to bring together a coalition of firearms owners, gun shop owners, and firearms instructors towards a voluntary do not sell list legislation and other related initiatives. Morissa, please take it away.
Good morning, everyone. I'm so honored to be with you. And before we dive into the topic at hand, which is a really important topic and a topic very much infused with a spirit of love and caring on this Valentine's Day, I do want to acknowledge that the topic of suicide and firearm deaths are really heavy topics for many of us. And so seeing Justin's background here on the screen reminded me just if at any time, you want to sign off or take a break, please feel free, and just always a reminder of the resources we have available, including 988. So that's my little preface. My other preface is just that I'm here speaking with you as kind of my as an independent person and reflecting on prior employment. And so the views expressed here are my own, not the Department of Health and Human Services, where I serve as Deputy Commissioner. So with that said, I'm going to share my screen and hopefully get So the topic of my presentation is finding uncommon ground, and it's a reflection on some work that I was involved with prior to this role, working in the state of Utah. And I was born and raised in New Hampshire, and so much of what I want to emphasize here today has been inspired by my upbringing, and much of the work that I have followed that has gone on in this state, which we'll have a chance to talk about later. So diving in, I want to share a photo with my friend Clark. So Clark Aposhian is the head gun lobbyist for the state of New Hampshire, who I got to know while working on my dissertation and then eventually transitioning into a full-time job focused on suicide prevention and community behavioral health for a large health system in Utah. And we're pictured here having one of our many intense conversations. This one happens to be located in a shooting range, one of the largest in Salt Lake City, Utah. Because when I came to Utah, there was an emerging coalition of gun owners, very much led by Clark and the Utah Shooting Sports Council, who were deeply concerned about the issue of suicide, who were disproportionately impacted by it, and who were thirsty for the type of data that young researchers and practitioners like me were diving into at that time to understand how to approach suicide through a public health lens. And so I want to open by just acknowledging that, again, in the spirit of sort of compassion and connection, building bridges this Valentine's Day, not a typical place that a doctoral student finds herself, but it turned out to be a really important classroom and place of emerging relationship for me. So just to orient us, and I know that there are many experts far more attuned to this data than I on this call, but it's worth noting that New Hampshire has a high suicide rate. So 15 per 100,000 is how we measure suicide in a sort of per 100,000 population, slightly higher than the national rate. And perhaps most important to this discussion, 90% of gun deaths, roughly 90% of gun deaths here in New Hampshire are suicides, which is sort of striking, not just because of the raw number, but also if you compare the number of suicides versus homicides in New Hampshire, not only do suicides far outnumber homicides in any given year, but the suicide rate has over the past decade or two been on the rise, whereas homicides have been quite flat. So obviously a critical issue. So as I started working with colleagues at the Harvard Injury Control Research Center, as well as with the local Utah stakeholders I was getting to know, I think there's one study that I think really illustrates a bit of what is critical to understand about this problem in states like New Hampshire and Utah that I find kind of cuts to the chase here. So this is a study by one of my dissertation advisors, Matt Miller, that looked at two groupings of states with the highest rate of gun ownership, so homes with at least one firearm, versus those states with the lowest. So New Hampshire falls into that high gun state category. And he grouped these two states. It turns out they have roughly, I think it was around 15 states and 6 states, roughly the same population. As I said, by definition of the groups, the high gun states had very similar to New Hampshire, about 47% of homes having at least one gun versus 15% in the low gun state group. And the striking thing that he found is that the number of non-firearm suicides was almost identical. So suicides by methods other than firearm, hanging, overdose, poisoning, all of those categories was about the same. Where the drastic difference was occurring between these two groups of states was in the number of firearm suicides. And that is what was accounting for the difference in overall number and rate of suicide. And so many studies have been done since this time, but this is one I think that illustrates that if we're going to take a public health approach to this problem, obviously we need to be doing lots of different things, from increasing access to mental health to ensuring that people who are in high-risk situations are getting additional services and having their social needs met. But we also need to zero in specifically on this issue of firearm safety. And it turns out that the issue of, or this opportunity to put time and distance between a person with a suicidal impulse and a highly lethal method is one of the most effective ways to do just that. So we call this lethal means reduction. And there's lots of examples outside of just firearms that include things like bridge barriers. And when in countries like Sri Lanka, when they reduced the availability and the toxicity of certain pesticides, they saw the suicide rate dramatically decline because that was a favored method. Pill containers that make it much harder to swallow large quantities of pills in a short period, and the conversion of domestic gas in Europe. So these are all examples of the robust international evidence showing that when you make widely used and highly lethal methods less available, suicide rates drop by as much as 50%. So why does this work? And I'm going to go through this very briefly because I want to really get to the policy opportunity at hand that we have to talk about. I'm going to go through these three basic reasons. The first is that suicide attempts often occur with very little planning. So even though some people may be thinking about suicide, the actual time from when they thought about taking action on an attempt and actually taking attempt has been shown through research to generally be less than 10 minutes. So 75% of people said less than an hour, and about half of people surveyed who made really serious attempts said it was less than a 10-minute period, so really short period. The second is that guns are just in a category of their own. So in public health, we talk about case fatality rates, meaning the percentage of people who will actually die from an attempt. And we're very cautious with these numbers, by the way. We don't necessarily want to advertise to people the lethality of firearms, but for purposes of this discussion, it's worth noting that 85% of attempts with a firearm result in a death compared to 2% or lower for other most common methods, overdose, as well as sharps. So we're talking about a short period, as I just said, of high risk, as well as a deadly, quick, irreversible method. And so any steps to increase time and distance between a suicidal impulse and a gun will reduce suicide risk. Thirdly, despite kind of many people thinking to the contrary, it's just not true that people will find another way. So over 9 out of 10 people who attempt suicide and survive do not go on to die by suicide later in their lives. So if you can get through that short-lived period, get people the support they need, recovery is really the norm. And I think if we can kind of recognize the opportunity at hand and how that opportunity can be dramatically altered in the most devastating of ways when a firearm is involved. So going back to the relationship with Clark, over several years, Clark invited me into this emerging coalition that included gun owners at the heart of the group. So we had actual, so sort of Second Amendment groups. We had law enforcement, veterans groups brought together with those of us on the health profession side, as well as survivors, researchers, to say, what can we do about this work? Much of this was modeled on efforts that had been going on in New Hampshire for a few years, which we can talk about later. And this was actually a pretty paradoxical and sort of controversial group, I will just say, and we can talk more about that there's something sort of unexpected and even often criticized about being a health professional who joins with a gun owner group, or vice versa, for gun owners to come to the table with public health professionals. But we really came to see that open dialogue was not only possible, but really critical. And part of that, and this is Clark and I at actually March for Our Lives event that came through Utah, part of that had to do with really stepping back as a group to understand the underlying attitudes and beliefs around gun ownership. And so to put it most simply, for some of us in the group, guns are symbols of violence. Gun regulations are seen as increasing safety. Guns are not seen as being necessary for safety. Guns are mostly harmful, and gun violence is seen as diminishing our personal liberties. For other members of the group, guns are important symbols of personal freedom. Gun regulations limit that freedom. Guns are a crucial element of personal and family safety. And guns are seen as beneficial and, more importantly, a core constitutional right. But what our group came to see is that we had something really important in common, which is that all of us wanted our loved ones to be safe. All of us were unified around this horrific recognition that gun deaths, 90% of gun deaths are suicide. And so that became our common goal, was no person in suicidal crisis should have ready access to a firearm. And so to bring it to the, finally around to the topic at hand, we did many, many things over the years, ranging from trainings for health professionals to giving away free gun safes to many, many different aspects of sort of social norms campaign, public awareness. But something that caught our eye as a coalition was what Washington State was doing around the voluntary gun restrictions for people at risk. And so the idea here was, can people who realize they may experience a future impulse to harm themselves take preventive action to reduce their access to lethal means, putting themselves on a voluntary temporary list that would suspend their ability to own and or purchase firearms. And so this was basically a really big leap of us, and you can see Clark and I having a very robust debate or about this idea on his Gun Talk Radio Sunday show. Could we actually mimic what Washington did, but with the buy-in of the gun community? And that's exactly what we attempted, and it took a lot of legwork. But the basic concept around the Utah law was that we designed it so that there were forms for download. An individual could download those forms and sign themselves up on the list by bringing the form to law enforcement with their ID, or, and this was really critical, have their doctor, nurse, mental health professional electronically deliver it on their behalf. And then within 24 hours, they're added to a list, and they could choose from 3 different types of lists, and choice was really important. They could restrict for 180 days, and then it was automatically, their name was removed after 6 months. They could restrict for 1 month with automatic removal after a month, or they could restrict indefinitely and still have the opportunity to change their minds 90 days after being added. This automatic removal and this option was really important for getting the buy-in of the gun community on this. It was really important to also destroy records. The issue of privacy and confidentiality, super important to the gun owning community in particular. And so we built that in as a core tenet of the Utah design. I think just building on what I said earlier, there were also really important interpersonal and kind of coalition dynamics that I just want to acknowledge. In Utah, which is arguably the most pro-gun state in the country, we could not have done this without a great deal of understanding and trust that was built over many months and years. We did it in a way that really foregrounded pro-gun values. We focused on that temporary period of risk and safety, and really acknowledge that this is a sacrifice. If for you, safety is having a firearm under, in your nightstand, having to reduce that access is actually a pretty significant sacrifice. We emphasize privacy and confidentiality, as I said, built on those common values that had underlied our work for a long time, and focused on prevention rather than prohibition. And we did it. And so we were recognized for, being one of the most pro-gun states in the US that did this with the backing of gun advocates. And it's taken some time. And as any of us who work in or around government, it does take time to actually implement innovative, creative laws. But the forms are now posted, and as of last May, we can talk more about kind of implementation. But I'll just say the area that Utah is seeing the most success and take up is really in that healthcare linked delivery of the form. So a conversation between a patient and a clinician that leads to them collaboratively filling out the form and deciding to take that step toward lethal means reduction. And I'll just close with a favorite quote that I think is really important on a variety of public health and human service topics, but really stood out and became a lesson learned for me in this arena. And it's a quote from a sociologist I love, Arlene Hochschild, who wrote a book about conservatives in Louisiana in 2016. And she writes that we on both sides wrongly imagine that empathy with the other side brings an end to clear-headed analysis, when in truth, it's on the other side of the bridge that the most important analysis can begin. And so I just want to say we could not have done this without the bridge building, and also the ability to step forward on that bridge, not just by those of us in the Public Health, Human Services Committee, but more importantly, those who bring the unique expertise and have been most affected by this issue. So I'll stop there, and excited to engage in dialogue and hear more from the other speaker.
Thank you so much, Morissa. I have so many questions, and this will be a great conversation. I would like to give Representative Meuse the opportunity to share briefly what is going on in New Hampshire on this similar bill, a similar bill in line with bringing together groups that might see differently initially, as you've talked about. I also would like to welcome Justin Moeling, who is co-chair of the New Hampshire Firearm Safety Coalition, to speak after Representative Meuse, to share some of his experiences with the Gunshot Project that you mentioned had inspired you. Justin is a Coast Guard veteran and licensed clinical social worker at the VA. So we are so delighted to have Justin on board also. But Representative Meuse, you have represented your district for a number of years, and in Portsmouth, Newington, and I'm sorry, I forget the other municipalities that you can share, but really have brought forward a number of bills in this area, and we're looking forward to hearing what you are doing in New Hampshire this session with HB 150.
So by way of
1050.
okay, so the bill in New Hampshire, the do not sell list bill in New Hampshire is HB 150. And my role in that bill was actually prompted by a call I received last summer from a woman named Donna Morin, whose 21-year-old son had a bad breakup of a relationship, went to a gun shop, bought a firearm, drove home and killed himself all inside of about a half of an hour. His family was stunned because he didn't seem like the kind of kid who would have done something like this. He was stable. He was happy. He just didn't fit whatever we think the profile is of someone who does something like this. When I spoke to Donna, his mother, one of the things we talked about was how a do not sell list law wouldn't have helped her son Nate. And she was quiet for a moment on the phone, and then she said, "This bill isn't actually for Nate. This is for me and my daughter." Because ever since Nate's suicide, both Donna as well as her daughter have had suicidal ideations at times. So that was the motivation for the New Hampshire bill. Our bill is a little bit different than the Utah bill. We're a partial point of contact state where handgun background checks are administered by the Department of Safety. Background checks for long guns go directly to the FBI NICS database. We would actually have our Department of Safety administer this list. And essentially, what we've done in the bill is we've outlined what I would call business requirements for the operation of the list. So after an application is received, 1 business day to actually appear on the list, a 60-day minimum before removal can be requested. You would be on the list indefinitely unless you request to get off of the list. But one of the things that we do that's a little bit different, or would do that's a little bit different, would be at the end of the year to send a reminder letter to everybody who's on the list that they are still on the list, as well as information on how to get off the list if that's something that they want to do. So it's just another way to handle it. Another thing that we were able to benefit from was the learning experience by some of the folks in other states. So one of the things that we understood got in the way, and I can't remember if it was Washington or Utah, was the fact that there was actually no penalty for a person who's on the list to actually attempt to purchase a firearm. The problem with that is the FBI won't actually list an offense on the system unless the offense has a penalty. So to actually have the NICS system work for you, the violation actually has a penalty. So in New Hampshire, one of the things that we did is we made it a violation level penalty, which is the lowest penalty under New Hampshire law. It's a maximum $1,000 fine. There's no criminal record. And it's also listed in NICS as a state prohibition. So the federal background check system has federal prohibitions, such as felonies, but there are also certain state crimes that make you ineligible to purchase a firearm. And there are also situations like being on a do not sell list that can put you in a position where you are not able to buy a firearm. So we had broad support from this idea from mental health advocates. We also had opposition, and I don't think we quite expected quite as much opposition as we got from some of the gun groups. But in New Hampshire, I think that's par for the course, and we expect it. Despite the opposition, we did get it through 11-8 in the Criminal Justice Committee. It next goes to the House for a full vote, for a floor vote. If it passes in the House, it would go on to the Senate, where it would even receive another public hearing in the Senate, another vote in the Senate, and if it passes there, it would go on to the governor for signature. On the next slide, one of the things I also kind of wanted to make you aware of is that bipartisanship in this area can have a little bit of a personal cost. And I think people on both sides of the issue need to be prepared for this. So this is a postcard that one of the other reps on my committee received because he hadn't made his position clear on another bill. So I'm actually working with Terry Roy, who is the Republican chairman of our committee, on a bill that would end New Hampshire's status as one of 3 states in the nation that doesn't report people adjudicated a danger of to themselves or to others who are mentally ill, doesn't report them to the FBI firearms background check database. This particular bill was prompted by the shooting of a former police officer at New Hampshire Hospital. And this was a situation where Representative Roy approached me. So I think from a bipartisan perspective, one of the things that you always have to do is to be receptive to conversations like this. It's important, no matter how much you disagree, not to burn any bridges. And the fact that we hadn't done that, opened some ground for us to begin a conversation on this particular bill. But when you talk about crossing bridges and working together, one of the things that can be a real challenge is that these bridges can be very hard for other people to cross. And so in New Hampshire, at least, this is what you can expect in terms of the reaction that you get from some people when you put things forward like this. And essentially, I look at it as a cost of doing business. And I focus on the people whose minds I think I can change. And I'm always willing to work with anybody to do that. And I'm also, I can also have my mind changed. I actually voted on a bill this week in committee that I did not think I would be voting positively on. So I just think it's important it's very important to listen.
Thank you so much, Representative Meuse. And your comments remind me that change happens at so many different levels. And by the time it bubbles up to committee and television and streaming and then gets boiled further to, words on postcards, it can be hard to get the cat back in the bag, right? And so I'll be interested in the discussion on sort of what happens before and what happens outside. And I'm just so delighted that Katrina Breeze, who is the daughter of Donna Nathan, for whom the federal bill is named, is on the call. And I hope we'll be able to share some of her experiences in different states and federally in sort of building bipartisan and round support for this type of model. But Justin Moeling, tell us please about the New Hampshire Firearms Safety Coalition and the Gunshot Project. We will want to have time for Q&A and discussion, so keep them brief, but your work here has been incredible and has clearly inspired other states to follow suit as well.
Good morning. Thank you for having me here. As Jussi mentioned, my name is Justin Moeling. I'm a social worker with the Manchester VA Medical Center. I'm the Community Engagement and Partnerships Coordinator for Veteran Suicide Prevention. My focus on this, I'll be talking mostly about suicide prevention, but I think there are other ways that this bill can apply, things like relapse to substance misuse and that kind of thing. We'll just probably spend most of my time talking about what's the scope of my work. So aside from the New Hampshire Firearm Safety Coalition, I've been building coalitions around the state for veteran suicide prevention. The VA's strategic focus areas for suicide prevention includes a few things, including lethal means safety, which is very important. And that reflects the National Suicide Prevention Plan, the State Suicide Prevention Plan, and it kind of goes back to sort of the core evidence-informed strategies or focus areas that come from the VA and the CDC and SAMHSA working together. And I think those are things that get replicated. I know I really appreciate Morissa's presentation. It covered a lot of things that I was hoping would get presented today. I know she mentioned that her dissertation supervisor was Matt Miller. He's I don't know how many bosses above me he is, but he's a wonderful advocate for veterans and suicide prevention down at the VA central office. The New Hampshire Firearm Safety Coalition, I've been involved with for about a year and a half. My bias in that is that I want to bring the veterans' perspective to that conversation and to ensure that veterans are represented in that community discussion. The New Hampshire Firearm Safety Coalition has been around since about 2009. It's been pretty active in the past. We're working on sort of trying to get it revamped. COVID kind of set us back a little bit. And then sadly, one of the founders of the group and a real champion in New Hampshire for firearm safety prevention, Elaine Frank, who was one of the founders of the group, passed away. So we're looking at sort of figuring out how we move forward from here, but the overall mission continues. We've got some wonderful participants in the group, from Dartmouth to Harvard to local firearms instructors.
Justin, I'm going to guide you to the specific question of, for the Gunshot Project, what of the lessons and perspectives that Morissa shared around bridging stakeholders that you might not usually think of as being in the same room together resonated? What would you add to or change? You told me yesterday even differences in language can make a difference tactically in who is receptive and comes to the table. Are there just a few of those nuggets that you would share with the group?
Sure. I guess I just wanted to share one last piece about how this group got together. Back in 2009, at Riley's Gun Shop in Hooksett, 3 different firearm sales resulted in individuals killing themselves shortly after. And that's part of what captured the New Hampshire gun community's focus on really caring about their customers and the community. The other incidents include, there was a person who killed themselves on the firing range in Manchester. So there were some really tragic incidents that have really showed that the gun shop community was really kind of passionate about suicide prevention. So by bringing the gun community, or as Elaine Frank would call them, her gun guys, to the table, it allows for things like having conversations about what language makes the most sense. I think when you've got a room full of very progressive-minded folks, I think it's easy to start talking the same language and not realize it. And I think that I've seen folks who are, passionate about protecting their gun rights look at very well-meaning lethal means safety materials and education materials out there and kind of get defensive about it and kind of, get concerned about it. The VA has a national partnership with the National Shooting Sports Foundation. And in some of their research, they identified things like safe storage is something that it makes sense, I think, for many of us to talk about that. But for someone who's a gun owner who believes that they're managing their firearms safely, that seems critical. So secure firearm storage became a more neutral term that was more appealing on both sides. I think I've been in groups where it's easy for folks who are a bit more on the progressive side, as Morissa's slide indicated, I think can get a little bit confrontational about it, which immediately sets a stage for folks being defensive. And I find that as a result of that, not Marissa's work, but just that ongoing conversation, it's created that much more of a polarizing environment. And I think we can do that inadvertently when we don't have both sides of the issue talking. I think in the mental health world and in other sort of public health worlds, they talk about policy as, nothing about us without us. I think it makes sense to pay attention to who's not part of the conversation, and even if we don't agree with what their arguments are and what their stances are, it's really important that they feel heard and that their side is supported as equally as the other in order to have constructive conversation.
No, it's interesting. We often use the nothing about us without us for, for disenfranchised groups or those that would feel that policy is being imposed on them. And in this situation, as Morissa was saying, to get to the very core of, one's assumptions and cultures and upbringing, and to realize that the compromise and sort of the understanding happens first on the other side of the bridge, I think is key. I'd like to introduce Katrina Breeze, who is really the impetus and catalyst for this nationally. And Katrina, would you just spend a minute telling your mother's story and then comment on what you've seen in the areas that we're talking about, in this sort of this messy arena of working together to save lives and still respecting rights and ways of life?
Sure, thank you. I lost my mom, Donna, in 2018 to an impulsive gun suicide. She was experiencing very serious side effects from an antidepressant that she was prescribed, and it caused impulsivity, psychosis. She was hearing voices. She could barely walk. She experienced insomnia. A lot was going on, and she was under the care almost daily of a psychiatrist. She had voluntarily put herself into lockup confinement 3 times in the near past to her death. And we really did everything. Her boyfriend quit his job so he could stay home with her because we were all very concerned about this. She wrote to her doctor that day, begging for help. He's considered one of the best psychiatrists in our state. We really did everything. The day that she walked out the door, our family called the police 5 times, begging for their help to stop the sale. After it happened, I got her phone and I was able to unlock it and see what the phone said. And I will say, what I'm about to say, I hope that people understand that this is another place that we can make change, and that is with what people are searching. My mom searched how to hang herself. And at that point, then Google showed her an article about the lethality of means, and how essentially my mom's best bet was to buy a handgun. And then it directed her to the closest gun store, where she purchased a handgun and a box of pink breast cancer bullets that looked like makeup, and then went to the public park and shot herself there. It was devastating to our family. It is it's totally life-changing. It's economically changing. It's career changing. It's everything. It has changed everything in our family. And immediately after her death, I felt like what could have been different, which I imagine that's what every person feels after this. And I couldn't understand how she was sold a gun, because she had been in psychiatric care, and I just assumed that meant that she would be prohibited from being able to do that. But that's not the case. When someone is involuntarily committed, they receive that tool to their benefit. But when someone is voluntary and self-advocating, they do not get that tool. And for sure, if my mom had that tool, she would not be dead right now. And Also, much like Donna Morin said, this law isn't for my mom anymore because my mom is dead. And this law is really for the rest of our family. And I immediately after her death began struggling with intense suicidality. It was like my brain totally changed. The trauma is so significant. And when we talk about suicide being like the 10th leading cause of death in America, that's a that isn't necessarily the way it really is, because when you really break down all those, like it, like, you know, there's like accidents as a category, you know, and like all these things that are like pushed together. And so if you really think about it, like there are families out there like my family where this is the #1 cause of death. When I look at my family tree, everyone who's dead under 80 years old died by gun suicide, and none of us are gun owners. So that shows you that people are just having these moments of crisis. And in our family is very affected by medications and by psychosis increases as side effects. So our family is like very well aware of this potential at this point. So yeah, immediately I started doing this work. I grew up in Massachusetts, but I live in Louisiana, and my mom died in Louisiana. I took it to Baton Rouge here and was pretty disappointed pretty quickly. And now I'm just working on getting it everywhere. A couple years ago, it made it to Congress, and then with the elections, it shifted. Because I'm a self-employed radical artist with no institutions suppressing any of my ideas, I do want to bring up the NRA, because for many years when I was doing this work, I was told, do not say NRA. And I was intimidated, and I would not say this was by the general gun community or the gun guys. This is the gun lobby. And I look forward to one day working with them. I'm willing to build that bridge, but someone has to say what it really is. I mean, I live around and have lots of gun owners that I know that support Donna's law. And when I get into the space of my representative or a sponsor trying to discuss this across the aisles, trying to, you know, save lives, it's not just the gun owners, it's not just all the gun lobbies. It's really the NRA. And I'm sorry to like blow that up, but someone has to say it.
Georgina, what have you found? And you know, you're making me think again of the difference between people and institutions, right? And how people at a human level can find connection. At the Carsey School, our New Hampshire Listens program brings together people around, you know, around tables to have honest conversations at a community in community dialogue around some of these really contentious issues. And when you get to the human level, you often can find the connection that Morissa and that Justin have talked about, you know, versus institutions that often have their own motivations and their own levers beyond that. But just, you know, very briefly, and then I'd love to hear you ask each other questions almost. We've never had a panel this big, but you all have something to contribute. You know, what has worked in bridging, you know, sides that might seem entrenched otherwise? And also I want to thank you, Justin, for typing in some answers to the question in the Q&A. What other language tips could be used? And if other panelists have ideas there, please jump in as well. But Katrina, at a national level, particularly perhaps in states where you wouldn't think a bill like this would have a chance, what has worked?
I mean, I'm an artist. I work in Mardi Gras. And so politics is very new to me. And if I had to define what it is, it's building relationships. And so I think that in places where there are a lot of really good relationships with extremely high suicide by gun rates, like New Hampshire, it seems to do well. It's currently, I mean, it's spreading fast. Like, even though it was just in 3 states, like there's probably about a dozen bills currently across the country. And as less options are are available to states, something like this becomes more desirable. The states that need it the most are the states that are going to want it. For example, like in Massachusetts, there's a bill, but if it takes someone 5 months to get a gun in Massachusetts, like, is it really that like valuable to, you know, take up legislature time with it? I also was curious if there was any information about the guns from New Hampshire in other states like Massachusetts. I grew up right on the border of Massachusetts and New Hampshire, and I mean, we used to go to New Hampshire for all kinds of things, mostly tattoos when I was a kid. But yeah, I'm curious about that, whether there's any information.
Thank you, Katrina. And it'll be interesting to see the prospects of the bill at the federal level. Bringing it back to the relationships, Morissa, I wonder, based on your Utah experiences and also what you've heard of New Hampshire, if there are, what reflections you have on, on ways to move forward here, and the types of relationships perhaps we should focus on building.
Yeah, so I think, I mean, first, just thank you so much, Katrina. You've been a hero and an inspiration and involved in passage of, and the advancement of the bill in many states, but also its passage in states like Utah and, of course, the federal level. The other heroes who I am embarrassed I didn't mention is Fred Bars, law professor, and just extraordinary activist and source of wisdom to all of us. And I don't think any of the states that are considering this could have done it without Fred's work and as well as that of Kathy Barber and Elaine Frank. I think what I would just say is, like, there's lots of ways to get bills passed. Every state has to have its own ground game, its own strategy. The part that I think about, especially in learning over the years, working with the gun community on a lot of things, is like, we have to remember that this is not a homogenous community, just as like no community is sort of a monolith. So just as Justin provided a perspective, bringing in the veterans angle here, like, I guess what I would say without overstepping here is, like, the NRA isn't the best indicator of where most gun owners fall on issues. And that's been well documented in terms of sort of sensible common ground strategies. And the reason why I think it's valuable to engage with gun owners is the same reason why in my day-to-day work, I think it's really important, like essential, to engage with people who have lived experience in the mental health system. If you're going to talk about making systems changes, or in the child welfare system, we have a huge movement to focus on families who have actually interfaced with us in the context of situations of abuse and neglect, to say, how can we better serve other families? Because if you implement policy change without engagement, the problem is this has already been said, but like the question of implementation becomes a challenge. So with Utah, we could have just passed the bill, and if it's seen as a gun grab, then we have a little bit of an issue in terms of it being a useful tool that gun owners take up. Whereas I think one of the, again, unique advantages we had, and we were very fortunate due to a lot of groundwork laid, is that now, as we think about how to improve that law, like, how do we create an online system for registering so you don't have to go into a police station? How do we build the political will to actually put some, money behind that? We actually get to work with gun owners to craft those messages, strategies, and financial appropriations, because they're not opposed from the outset. So there's a little bit of, like, it's about passing the bill and taking a state-specific strategy, but it's also about thinking through, how does this actually become a useful tool? And are the people engaged and listening who you're actually looking to have use the tool at hand? So I guess that's just one of the things in New Hampshire we can think about. The conversation isn't over based on this session. It's like, how do we think about what this tool would mean over the years ahead? Because that's where its utility would be proved, not in passage of the bill alone.
You don't want to enter a conversation where the other person or the people around you think that you have a predetermined outcome in mind, right? And so, and yet we do have these national models for, for legislation or for initiatives around, gun security, gun responsibility, other models that are successful. So how do you balance the fact that there are, evidence-based models that someone coming from public health might know about, but still enter a conversation without seeming like you're driving towards a predetermined outcome.
It's really slow work. I mean, I think that's the problem too, is for those of us who are impatient to make change and to see the dial shift on the empirical measures of population health, like it really is slow, challenging work. It's a lot easier to implement systems change at any level by just doing it and saying, oh, we've got the ideas, we've got the data, we're the smart people, right? But that's not gonna achieve much. So I'd say first is really thinking through the pacing and how do you slow down to speed up, as one of my colleagues has said. How do you engage in those long, hard, debate-ridden conversations in order to think through the implications and who are the best messengers of a given approach? Oftentimes, it's not the deputy commissioner. It's not necessarily a legislator. Much as we are proud to have the positions and the microphones we have, like we need to start the conversation, not be the sole folks coming forward. So I think that's it's about accepting the slow and relational work that Justin and Representative Meuse and Katrina have talked about.
Justin, you've unmuted.
Yes. One of the things that I find helpful as a clinician is thinking about motivational interviewing, where you're trying to encourage the person you're talking to be persuaded to address the change that you're looking for, as opposed to a confrontational approach. And I think that when we listen first and hear what the other side is saying and concerned about, when those folks feel heard, they might be more likely to listen. Whereas I think if we come out strong in a confrontational manner, which is really hard when it's an emotionally charged situation, when you've got folks who are survivors of loss and that sort of thing. I don't want to minimize that at all. I think that those folks' experiences are valuable. But I think we just have to be mindful that if we're trying to find common ground, we have to be willing to accept common ground.
It feels to me that there is this ground game where Justin and the coalition members have been building these relationships, making incremental and very positive moves, and at the same time with media playing a role, as Michelle Holt-Shannon, director of the New Hampshire Listens project, mentioned in the chat. It's almost like there's and these very real tragedies, there's a wave coming over almost of motion towards gun control and gun restriction, and the certainty of pain that comes from pain and loss. And so how do you balance again this sort of slow relationship building and on the ground, that nothing about us without us, and that Morissa has talked about, with this sort of wave of real tragedies that lend fire and perhaps too much certainty and not enough listening to efforts to avert future tragedies.
I just added a comment to the chat. I think Justin referenced it and you did too, but the Gun Shop Project really did inspire this kind of movement across the country. And I think Justin and his Kathy Elaine, like the whole team behind that, deserves so much credit for saying, like, here's sort of a blueprint. And I'll just note, and actually Kathy and I worked on a paper on this, that the evidence was actually kind of remarkable, that after designing and delivering these posters and brochures to help gunners avoid selling a firearm to a person in suicidal crisis and educating them about signs of suicide risk, after doing unannounced visits, half of retailers were still displaying their campaign components 6 months later. And there were some other kind of empirical data points we were able to evaluate. I mean, that's kind of amazing if you think about, like, again, what is the long road of social norms change? Like, it's generally we in positions of like well-intended leadership just can't get that staying power or that resonance if we don't take the time to kind of collaboratively craft it at the outset.
I dropped a link in the chat that actually has a link to the poster session for that project that really gets into the data and who was involved. Um, there's also a link to the New Hampshire Firearm Safety Coalition, which is embedded in the Connects program at NAMI, if you're having a hard time finding it. What is some of the stuff that's in there is some resources for dealers and instructors, and a little bit of information in order to empower those folks in order to take constructive steps. And how do you interact with your customers? How do you interact with folks in a way that is helpful and empowering for the gun shop owner? I put a few other links in there. I tried not to sort of bomb the whole chat with stuff, but one of the members of, well, two of the members of our coalition have moved out of state. One of them is Ralph D'Amico, the former owner of Riley's Gun Shop in Hooksett, who's been a real big champion on these efforts in New Hampshire and is well known in the gun owning community. And then also Masad Ayub, who's a nationally recognized firearms instructor, and considered a professional by many in that community, who's also an author in Backwoods Home magazine, where he's been able to put this message out into a community that is more conservative. Those are in the chat if folks are looking for them.
And I'll follow up with all panelists to take these links and get others from you and include them with the recording that will go up on our website. Another question from Bernie: it has been brought to my attention that community violence is a more acceptable phrase than gun violence. Can you speak about your experience on this type of rephrasing that may help in discussion? And I am again, maybe with the panelists, we can brainstorm on any guides to language. Of course, it's more than just using the correct words. It has to come with, an open heart and open ear, but certainly the language can be a turnoff if we use something inflammatory to start. So community violence rather than gun violence.
Sounds like
Thoughts?
Justin gave that his vote of approval. I mean, what I'll also say is, like, it's as much about asking folks who are affected by a policy, like what language resonates with them. So I think in different states, different times, like depending on what's happening in the political landscape, the winds can change. In Utah, gun safety was much preferred over gun violence, but never thought about community violence.
And Justin, what you said brings forth just the critical importance of credible bridge builders, right? People who have the respect of both coalitions, or can sort of speak to various sides while having the credibility, in this case, among the gun community. So shout out and thank you to those who have that membership and bravery to build these ties. I saw Katrina come on again. Well, I guess final thoughts from you, Morissa, as our lead presenter, as we go into what Representative Meuse knows for 1050 is discussion on the House floor upcoming, and as Katrina's national efforts continue and Justin's work with the Firearm Safety Coalition continues to build those genuine relationships at the ground level.
I mean, what I'll just say is just thank you so much for having this dialogue. Again, like, this actually was the first time that I had a chance in preparing for this several weeks ago to connect with Representative Meuse and Justin. This is our first time connecting, although I've heard a lot about you. Katrina, I've heard you testify, but I think these dialogues are sort of a microcosm of what we need more of, because and the public health approach really depends on doing lots of things, and each person pulling their lever, and every person's lever is going to be a little different on a complex problem. So I think what is happening here and what you're seeing is like slightly different approaches in different venues, different perspectives, but I think a willingness to kind of draw some connections and learn, and not be beholden to, we have to do it one way, but let's all do our things in all the ways and bring more people to the table. So I think this conversation kind of excites me, because it reminds me of how taking the time to engage in this dialogue is going to help any policy approach, but especially this one, ultimately be most successful.
Thank you all. Really appreciate it. And I know the conversation will continue. For folks online, the next Carsey Policy Hour on March 13th will be about community power, in particular, 2 ways of approaching community power in New Hampshire. One is through the Community Power Coalition that has gotten a lot of press recently for bulk purchasing for its municipal members, and also community solar, which wrapped up with net metering and other ways of, of renewable energy generation can move us towards a more resilient and state with lower energy costs, which we could all appreciate in these times. So see you then. Again, thank you to our panelists, and see you next time. Bye-bye.